We're getting a little bit of a break from the heat today in Houston, but you just know that's not going to last forever. And when it does get hot, we sweat. It's an annoying nuisance for most of us, but for some it can become a real problem, a real issue. Joining us this morning is Dr. Sherry Ingraham, a board-certified dermatologist. So, Doctor, when does excessive sweating become a medical issue? Where's that line?
The fine line is when our sweating basically exceeds our body's normal sweating to maintain thermoregulatory function.
Okay.
So there's some ways you can measure. Typically, a sweat mark under the arm should be about 5 centimeters. When it exceeds 5 centimeters when you're wearing clothes, you have excessive hyperhidrosis.
Wow. So your body normally releases sweat because it's trying to cool off. The sweat evaporates, cools you off, but sometimes there's just too much, and then it's not cooling you off. It's just making you really look yucky. What about over-the-counter products? I've noticed that lately some of the popular brands are advertising clinical strength. What is that, just a higher dose of whatever the active ingredient is?
It's a higher percentage of aluminum zirconium or an aluminum chloride, which can help block the sweating in some individuals. However, the majority of individuals with really true hyperhidrosis, which is about 3% of the population actually, they exceed even those, and so they need to pursue a medical or surgical intervention. Okay,
so what, ooh, surgical. Doctor, that's, I mean, just thinking armpit and surgical is scaring me. Tell me what types of intervention options people have to control
Usually what we do is we kind of go up a treatment ladder. So at an initial visit, I may suggest something like a prescription deodorant like Drysol, which can be applied nightly. It can burn in some instances. Other options include a pill like glycopyrrolate, which can block actually this excessive sweating, but it has side effects like dry mouth, other side effects. And then there's other minor surgical interventions, really what we call minimally invasive, like BOTOX, which has been shown to be very effective.
So the BOTOX would be getting a little needle stick in the affected area. How long does it last?
Usually it'll last anywhere in the axilla particularly, which is what it's FDA approved for, anywhere from 6 months to a year. We're seeing an average of about 7 months in most individuals. It's about 15 to 20 small pokes in each axilla. It's not painless, but it's really not that bad. People are thrilled. About 2 weeks to 4 weeks after the injections, they realize they're not sweating as much. They can wear their clothes. They're not ashamed. They're not embarrassed. They can go to work without being concerned about it.
What about if you know, most people have problems sweating from the typical areas, let's say like your underarms, but what if you sweat? Some people sweat in weird places. I mean, you have brow sweat, you have maybe some people sweat, sweating right there. What if you have, are there cases where people have excessive sweating in these other areas?
Yes, actually we've found, if you look at the research, there's clusters. People who tend to have what we call focal primary hyperhidrosis cluster either into the hands, foot, axilla group, which we can all treat with BOTOX, or they cluster into more of a groin area, facial, scalp sweating group. Those individuals do respond well in those other areas to either taking the pills, the glycopyrrolate, or you can now BOTOX in other areas as well, including the scalp and the face, to help them.
Very interesting stuff. All right, well, I hope this answered a lot of questions for you. And our advice is make an appointment with a board-certified dermatologist, right, and get some treatment if needed. Thank you, Doctor.
You're welcome.
Melissa.